This is Mehul Mankad, and I'm here with Eric Potter. Eric, tell us a little bit about yourself.
I'm a licensed professional counselor. Been treating trauma with children and their families now for about 10 years at the Center for Child and Family Health, and it's a pleasure to be here today with you.
Today we're going to be talking about the impact of PTSD on family members of veterans. So, Eric, tell us, how does PTSD impact family members?
Yeah, it's a great question. Parents who have their own experiences of trauma often have a difficult time being physically and emotionally present and supportive for their kids. We also know that when parents have PTSD, there's a high likelihood that they'll also have depression, and this can have a significant impact on the way that a parent parents. One way that PTSD can impact parenting is by influencing parents to interpret their child's behavior in a manipulative, negative, or harmful fashion. It is important to understand that especially for young children, developmentally, they are in a stage where they believe that they are the primary cause for most things. This means that they are the reason that their parents are, for their parents' anger or their parents' withdrawal, divorce, drinking, problem, etc. And the result ends up being that the child often blames them for their parents' post-traumatic stress disorder symptoms, or PTSD symptoms, although they are rarely able to articulate that. For children, this tends to create struggles with self-esteem and feeling safe in communicating with their parents.
What's important about being able to consider the perspective of the child when thinking about PTSD and their parent?
That's another wonderful question. PTSD symptoms that children see in their parents can actually be both frightening and confusing for them, because those symptoms actually can create inconsistency in the way that a parent parents. Unpredictability in a parent can actually be extremely scary for kids, and PTSD symptoms end up creating unpredictability. It can cause increased irritability and anger, which heightens this sense of unpredictability. So witnessing their parents experience symptoms of PTSD can actually often make mom or dad appear either frightening or very distant. And this can make it very challenging for a child to be able to go to their parent for support when they feel unsafe, or just for any other basic thing like support or guidance.
You've given us a lot to think about. I'm a parent, and I feel like I have a hard time being consistent, and I'm fortunate to not have PTSD. And so what really you're saying is, when you layer on a mental disorder like PTSD or depression or something else, that adds another challenge to just being there for the child and being the reliable parent that every child needs.
That's absolutely correct. Children often don't understand what is happening to their parent when they have PTSD, or why they're reacting the way that they are. For example, a parent might be triggered by something and overreact because they're responding as if they were in danger. For example, the child might walk into the bathroom and then the parent just starts yelling at them because they're thinking, hey, somebody's actually putting me in danger right now. And the child internalizes this in a way that makes them feel shame because they don't understand their parent's symptoms. And what they're actually internalizing is that they're just a bad kid, or that their parents don't love them.
Eric, what are some of the potential behaviors of the child of a parent who's struggling with PTSD?
That's a wonderful question. What I have seen in the office, as well just as life in general, is that children feed off of their parents' cues. So if a parent is struggling with anxiety, then their children tend to struggle with more anxiety. If a parent is struggling with depression, then their kids tend to struggle more with depression. And if a parent is struggling more with being able to control their angry behaviors, then children also are tending to struggle more with controlling their angry behaviors. What that might look like in children is that children with anxiety often have difficulty separating from their parents. This can cause sleep problems, such as difficulty sleeping throughout the night, nightmares. They might have difficulties experiencing or developing socially appropriate relationships. So maybe that might look like I'm not developing friendships at school. This also might cause other problems, such as difficulties with sustaining focus and concentration, which we know is super important for success at school, or if they're older, maybe for work. Children who are experiencing depression often struggle with feeling competent, and they can have a hard time identifying anything that they're good at. So we look for kind of islands of competency for children. They often feel pervasive sadness or hopelessness and have a difficult time finding enjoyment in things that should be enjoyable. Depressed children also might be very irritable or just seem like they're in a bad mood a lot of the time. And then on the extreme end of severe depression, there might be thoughts of suicide and sometimes thoughts about wanting to hurt others.
You're doing an amazing job of telling us that even though it may be the veteran who experienced the trauma can actually have multi-generational effects.
I would say that's one of the things that we see real consistently is that the impact that PTSD has on the parent, children are using parents as their guide, really, their compass in life. And one of the things that we might also see within children is this kind of angry outburst a lot of times. And so we see children whose parents are experiencing PTSD that it's more likely that those kids are getting into fights or arguments at home as well as at school with their peers in the classroom. They might struggle with behavioral compliance in the classroom as well. So if a teacher is asking them to do something, then they might start talking back to them. They might start talking back to other adults, even volunteers in the classroom.
Now, what can parents do to support their children?
Well, that's actually a great question, and I think it's one of these things where a lot of parents need some help in learning how to educate their own children about their PTSD symptoms. And if a parent knows and understands about their diagnosis of PTSD, it can be super helpful to talk to your child about what you're experiencing and why, because your symptoms can feel so unpredictable to your child and at times frightening to them. It can be so helpful to explain to them in a developmentally appropriate way about PTSD and what it actually might look like. This, for a child who a lot of times thinks that they're crazy or that their parent doesn't love them, helps to normalize it and validate their experiences while also underscoring that their child is not at fault and has not done anything to cause this.
So not necessarily sheltering the child from all the information, but not necessarily telling them all the information, somewhere in the middle.
It can be helpful to talk about situations or experiences that might not have gone well in their relationship. They could say something like, "I'm sorry that I yelled like that. I know that that was scary for you. I'm feeling calmer now, and I want you to know that I'm not actually mad at you." So if parents are concerned about how trauma is impacting their own child, then I would really encourage them to pay attention to changes in their child's mood, to their behavior, sleep, similar symptoms as to what the parent might actually be experiencing themselves. And if there are concerns, I would encourage them to seek out mental health treatment for them. I think the best thing that any parent can do is to be consistently present for their kid. So if PTSD or an addiction is interfering with the parent's ability to be present physically or emotionally, then I would strongly encourage them to get treatment.
So what you're saying is that depending on the developmental age of the child and the particular problems that are going on at home, an expert in dealing with family problems related to the parent's mental disorder can custom fit or tailor make the right treatment plan for that family.
Absolutely. And I think one of the things that I'm also saying is we have very good treatments for both adults and children together, and we can really help treat the system, and I think that that can be really encouraging for everybody.
Eric, thank you so much for joining us. I certainly learned a lot.
Thank you so much for having me here. I appreciate it.